My name is Zoe, and I unfortunately had a heart attack 2 years ago. I had none of the 5 risk factors that can cause someone to have a heart attack, so it was quite a shock to me when this had happened. I wanted to be a patient partner because I wanted to be able to see if I can make a contribution on behalf of patients to help staff understand some of the issues that patients encounter when they're hospitalized during such a stressful period for them. I'm a recently retired social worker and am thoroughly enjoying my retirement. I'm volunteering with homeless women, I'm taking courses, I'm cooking, and just having so much fun doing all the things that I wanted to be able to do and will continue doing so. But back to my story, and here's my message to you. To put it simply, patients should never assume that the healthcare team is on top of all of their issues on a day-by-day basis. And I'm not saying at all that patients should be untrusting. I'm not saying that they should be paranoid. But all I'm saying is that patients need to take responsibility, if they're well enough, for their health care, and doing this by asking questions or raising concerns to staff. I wanted to share with you the importance of staff sitting with and talking to patients about the need for them to feel free to ask questions and raise concerns with them. So here's why. After I had my heart attack, I unfortunately had a couple of subsequent readmissions. And in all of those admissions, I was on the patient portal and would always look at blood results and consult notes from doctors. In one of my admissions, the physician came in, sat in a chair next to me, and talked about discharge. I felt well enough to be discharged and said, that's great. And then I remembered that in one of my blood results, my hemoglobin was 83 and it said abnormal. If it hadn't said abnormal, I would never have thought that that was abnormal. But I said to him, just at the end of our conversation, I just wanted to let you know that my hemoglobin is 83, is that okay? And I'll never forget the look on his face ever. He went white and just kind of excused himself and walked out of the room saying that he'd come back. But during that period I was pretty nervous because I didn't know what that meant. So he did come back and told me that he suspected that I might be bleeding internally, and he wanted me to be scoped. And I was scoped the next day, and indeed I was bleeding, and it was from the blood thinners that I had to take from my heart attack. And I think one of the reasons that I was able to even have that conversation with him is because when he came in, he sat in the chair next to me. He didn't stand at the end of my bed. He didn't stand at the door frame, the door. And I felt relaxed and comfortable enough, and I felt that he cared enough to talk about discharge plans so that it calmed me down inside so that I could even think about asking him that question. And that was really very important to me that he had done that. I'm not sure that I would have been able to do that if he stood at the end of the bed with his arms crossed or at the door. So the lesson here is that if I hadn't taken responsibility for my health care by being on top of my results in the patient portal, I would have been discharged. I felt okay about being discharged, but I would have been back and probably in worse shape than I was at discharge. I want to reiterate that if staff can tell their patients, if they can just sit down with them for 2 minutes, 3 minutes, that's all it takes, and say, sorry you're in hospital, sorry you're not feeling well enough, but we don't want you to have to have concerns and build up questions and be worried unnecessarily. So when you have concerns or questions, feel free to talk to the person that you need to address the question to. And I think that if staff can do that, then it serves 2 purposes or 2 outcomes. One, prevent staff error, and that's what happened to me, was a staff error. And the second is that it will help patients to feel relaxed during their stay. No one likes to be hospitalized. It's scary to be hospitalized. No one likes to feel unwell. And so I think that if patients can at least feel comfortable enough and not afraid of quote-unquote burdening staff by asking questions or raising concerns, I think it'll help them in their recovery rate. And I think it'll also enhance the patient team interaction as well.